Now, I'll be talking about one of the very common problems in the community, what we call as an ACL tear. ACL, as we all know it is an acronym. It is called as Anterior Cruciate Ligament. It is one of the most common ligament injuries of the knee joint. Usually can happen because of a sporting injury, because of road traffic accident, twisting injuries to the joint, and because of these kind of injuries, patients might develop a tear of your ligament, what we call as an anterior cruciate ligament. Now, what is the importance of this ligament? The anterior cruciate ligament and the posterior cruciate ligament generally crisscross each other in the joint. That is why they are called as cruciates, and they are responsible for stability of the joint. Look, so if there is the thigh bone, the leg bone, and the two ligaments they need ligaments to hold them together, and that is called as the importance of the ligaments. Now, what happens if there is a tear of the ligament? Usually there is pain, there is swelling in the joint, and sometimes in the longer period, after a few weeks, patient starts noticing loss of balance or loss of stability in the joint. So even they try to do any excessive work like sudden change in direction, brisk walking, running up and down the stairs, they might have a sensation of the knee giving way, and every time this happens, they are actually damaging more in the joint. Now, coming to how do we diagnose it? One is clinical examination. Second thing is investigations like X-rays and MRIs to diagnose whether there is an ACL tear or not. Now, what do we treat it with? Partial tears can be managed conservatively. If the ligament is incompletely torn, then we can rehab it, physiotherapy, and then it can be managed conservatively. But if there is a complete tear, the problem is most complete tears of the ACL do not heal. So your knee is always deficient of the ligament, and then ends up causing pain and loss of balance issues. Most complete ACL tears will end up requiring surgery. Now, surgery is two varieties. One is an open method, which is outdated. What we do is an arthroscopic technique. Even in the arthroscopic technique, there are various things like transtibial, transportal, all inside. The transportal and all inside are the latest techniques. We do that at Sagar Hospitals. And then there are various graft options. What we do in an ACL surgery is take an alternative tendon, artificial ligament, put it in place of your native ACL and fix it there. There are various graft options. You should discuss with your surgeon about the different graft options. And rehab after an ACL surgery is very important. Physiotherapy, exercises, follow your surgeon's post-op rehab protocol very religiously, and patients are able to get back to all their normal activities. We have got patients who have gone back to kickboxing, football, swimming, and are able to do everything. Now, if you don't get the ACL surgery done, then you might end up damaging more and more of your joint every time you have that buckling or instability episodes. Thank you.